Today, the committee is holding another hearing on our series of how to make government work better. Our subject is the Medicare Part D program that provides a prescription drug benefit to seniors and individuals with disabilities. Providing drug coverage to seniors and disabled is essential, but it is also expensive. Over the next decade, the benefit will cost taxpayers hundreds of billions of dollars. We need to make sure this money is spent responsibly and with good value for the taxpayers. This committee has been investigating Medicare Part D for 18 months. During our investigation, we have conducted the only in-depth oversight of the Part D program. GAO and the Congressional Budget Office have been unable to review how well the program is working because the Centers for Medicare and Medicaid Services won't give them the data. And CMS, which does have access to data, refuses to acknowledge fundamental flaws in the program. Last October, I and other members of the committee released a staff report that examined the administrative costs of Medicare Part D. We found that the private insurers that deliver the Medicare benefit are charging taxpayers and beneficiaries $4.6 billion in administrative costs annually. In percentage terms, that's over 6 times more than it costs to run traditional Medicare. And we found that the Part D program is exceptionally lucrative for private health insurers. They made $1 billion in profit last year alone. Today, I'm joining with 10 members of the committee to release a new staff report, which I asked to be made part of today's hearing record without objection. Last year's report looked at the profits of the private insurers. Today's report examines the windfall revenues of the drug manufacturers. In this report, we compared the prices that the drug companies charge the new Medicare Part D program with the prices that the companies charge the Medicaid program. What we discovered is that the taxpayers are paying for far more for drugs under Medicare Part D than they do under Medicaid. In effect, Medicare Part D has given the major drug companies a taxpayer-funded windfall worth billions of dollars. Our report focuses on the cost to the taxpayer of providing drugs to the 6 million beneficiaries who are enrolled in both Medicare and Medicaid. These are Americans who are old or disabled enough to qualify to be on Medicare, and they are poor enough also to qualify for Medicaid. They are often the oldest and sickest Medicare beneficiaries, and their drug coverage is almost fully subsidized by federal taxpayers. These dual eligibles is what they're called. These dual eligible beneficiaries account for about half of all drug spending in Medicare Part D. The multi-billion-dollar windfall is a result of a provision in the Medicare Part D law that switched drug coverage for the dual eligibles from Medicaid to Medicare Part D. The transfer took effect 2 years ago. Since then, the drug manufacturers have been paid billions more for the drugs used by the dual-eligible beneficiaries than they would have been paid if the dual-eligibles had continued to receive their drug coverage through Medicaid. Under Medicare Part D, the 6 million dual-eligible beneficiaries can take the same drugs they got under Medicaid. The only difference is that the federal taxpayer is now paying 30% more. Added up, and it amounts to a drug manufacturer windfall worth at least $3.7 billion in just the first 2 years of the Medicare Part D program. In fact, the actual windfall could be worth billions more if all drugs used by dual-eligible beneficiaries were taken into account. Let me describe some examples. Johnson & Johnson earned over $500 million in additional profits, much of it from just one drug, the antipsychotic medication Risperdal. Bristol-Myers earned a windfall of almost $400 million thanks to the higher prices for the stroke medication Plavix. This is an enormous giveaway, and it has absolutely no justification. The drug companies are making the same drugs, they are being used by the same beneficiaries, yet because the drugs are being bought through Medicare Part D instead of Medicaid, the prices paid by the taxpayers have ballooned by billions of dollars. The privatization of Medicare Part D is a great deal for the drug companies, and it's a great deal for the private insurers. It's the taxpayers who are taking it on the chin. The circumstances that led to passage of the Medicare Part D law were controversial. The chairman of the House committee that wrote the Part D law now runs PhRMA, the Drug Manufacturers Trade Association. The administration's top negotiator left the government to lobby for health insurers and drug companies. There were allegations of threats and arm twisting on the House floor, but that's not the focus of today's hearing. The Medicare drug benefit is providing real help to seniors and the disabled, and it's going to be part of our health care landscape for years to come. The key question for us is how we can fix the program so that more of the benefit goes to seniors and the disabled and less winds up in the pockets of the drug companies and insurers. Medicaid is one proven model for how the government can use its purchasing power to ensure that it gets low prices. Medicaid is a voluntary program. No drug manufacturers are required to participate. Medicaid gets its low prices by making discounts a condition of manufacturers participating. The program says that if a manufacturer wants to sell their drugs to Medicaid beneficiaries, they have to offer Medicaid their lowest prices. The manufacturers also have to agree to protect the taxpayers from price increases that exceed the rate of inflation. We have well over a decade of operational experience with the Medicaid rebate. It works. It delivers $10 billion annually in savings to the federal and state governments. In many ways, this is the exact opposite of what is going on under Medicare Part D. Under Part D, the drug manufacturers can charge essentially what they want. Despite their high administrative costs and billion-dollar profits, the private insurers have been unable to stand up for the interests of the taxpayers. Now, many of our hearings on waste, fraud, and abuse identify problems that the executive branch can fix administratively. That's not the case with Medicare Part D. The waste in this program is the direct result of the statutory design of the law. Congress wrote this law and must lead the way to a solution. To start this process, I will soon be introducing legislation that will protect the taxpayer by bringing down the high drug prices in Medicare Part D. This bill will guarantee that federal taxpayers cannot be charged higher prices for the dual-eligible beneficiaries under Medicare Part D than under Medicaid. The potential savings to Medicare and the federal taxpayers are enormous. Passage of reform legislation could save the taxpayer almost $90 billion over the next 10 years. Even more could be saved if the federal government were authorized to negotiate prices on behalf of all Medicare beneficiaries. I'm looking forward to hearing more about this issue today and working together with members of this committee to improve the Part D program.